This podcast is brought to you by Delta Neuro Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Hey everyone, welcome back to the Neuro Health Broadcast. I'm your host, Dr. Joe, and today we're joined by Amber Bowers of Bowers Counseling and Wellness. Thank you for joining us today.
Thank you for having me.
Of course. So I'm really excited to talk to you today. I love NET. You practice NET. So I'm really excited for our listeners to get a better understanding of what that is and how that might be able to help them. I think, if you're struggling with a number of different things like anxiety or trauma, I'm sure you'll be able to list a number of things.
hmm
This is definitely the episode for you. So, before we get too into what NET is, what got you actually into the world of, I guess, mental health?
So I've been a counselor for over 10 years now. I've just always really enjoyed psychology and the brain and helping people. And so I've spent a lot of time working in higher levels of care, inpatient psych, with trauma, with eating disorders, active duty military. And in my time, I kind of gravitated more towards holistic, natural approaches to things, just kind of feeling like there are oftentimes the system just failing people and having people just repeat hospitalizations and cycling through, on top of struggling with some of my own health issues, just like chronic fatigue and feeling like I wasn't getting any answers with more of the Western medicine approach to things. And so I learned more about chiropractic care and through that found NET, Neuro Emotional Technique. And that's what's kind of, driven me to do what I do now and have my practice and be able to use these more holistic modalities with my clients.
That's awesome. And
Yeah.
so was that a tough transition going from kind of traditional psychotherapy to maybe something that's a little bit more maybe niche or
Um,
esoteric?
I think it was more of a challenge with the way that my thought process worked and, the way that I like to work with clients. It was more of a challenge working in my
Mhm.
other jobs. Now that I am in my private practice and I can approach things from a more holistic lens, um, I think it's been a lot smoother transition. It's a lot more enjoyable and it's a
Yeah,
lot more rewarding.
awesome. So I guess most people are probably fairly familiar with traditional psychotherapy and talk therapy and things like that.
Mhm.
How does NET differ from that?
So usually when I explain this, I like to first just explain like the three areas of our brain. So if we look at the reptilian, which is more of our unconscious, automatic processes, survival instinct, then we have our mammalian, which is more of our subconscious memory formation and emotions, and then we have our neocortex, which is our thinking brain. And that's primarily conscious. That's what we're using to be able to talk to each other right now. But 95%, if not more, of our day-to-day functioning is driven by those subconscious and unconscious factors. And so when we're in traditional therapy, like let's say cognitive behavioral therapy, where we're identifying thoughts and we're reframing those, we're spending all of our time in the neocortex. When we're using NET, we're combining the physical, the emotional, and the cognitive all together with the use of muscle testing and different principles from traditional Chinese medicine to be able to address all of those at once. So I have found it to be a lot more effective and efficient than more traditional forms of therapy, especially for those clients where maybe they're coming to therapy each week and they don't know what to talk about, or they feel like they've talked about the same thing over and over and just haven't gotten anywhere with it. It's been a lot more effective for working with clients.
Okay, awesome. Now that we kind of have an idea of, the differences, what does a typical session look like?
So it depends on the person. Like you said,
Hmm.
NET can be used to treat a lot of different things,
Hmm.
from different emotional things to even physical symptoms. So it really depends on the person. A lot of times I'll have people fill out what NET has. It's called the wellness check. If you go to wellnesscheckonline.com, you can fill out a questionnaire that has a number of different symptoms on it, and then it spits out a report for you, and it'll give the practitioner ideas of different areas that might be helpful to address, even from a physical perspective. So basically, if someone doesn't have any idea where to start, we'll kind of start there, or I'll use some of my other techniques to figure out what the priority is to address. But let's say someone wants to come in and they want to work on anxiety or they're having a hard time sleeping. We could either do a mind entry or a body entry. So for something like that, we might do more of a mind entry where either they picture themselves falling asleep and then we do NET based on that. Or they say a statement, which we call a personal declarative or an I'm okay statement. So they would say, I'm okay sleeping. And we would muscle test to see, is there anything preventing them, potentially subconsciously preventing them from being able to fall asleep or being able to live without anxiety, different things like that.
Hmm. Okay. And so let's say we identify, I might say I'm okay with sleeping. Maybe that comes up as maybe a false statement subconsciously, right?
Yeah.
How do we then go about addressing that?
Yeah, so I would have the client say say, I'm okay with sleeping. And if it's not congruent, so we're looking at the muscle test, it's either going to stay strong or go weak. So if it's not congruent and the muscle goes weak, then this is where we tie in the principles from traditional Chinese medicine. So we do what we call a map to figure out which emotions and which organs are associated with that difficulty sleeping. So let's say it came up to something in the fire meridian and ended up being a feeling of vulnerability. Then when we would see, okay, how could you put vulnerability together with being okay sleeping? And then we would figure out a core concept from that then we would test to see, okay, where's the original age where there was vulnerability because of, let's say, not feeling protected.
Mhm.
And then we would go back to that age and see, okay, where were you? What were you doing at 5 in terms of that vulnerability and not feeling protected? And then we would link up to the meridian and then these 2 points on our forehead, which are our emotion points. And then we would be able to clear the emotions that way from the body. We would retest to make sure that it was cleared, make sure that there wasn't any other emotions connected to that.
So I could be struggling with sleep here in 2025, but really the root cause of my problems might be from 2005, and I just didn't realize how big of an issue that was.
Yeah. And I love also just get to give also an example from a body entry perspective of what that could look like.
Hmm.
Um, One of my first experiences with NET was based on pain in my foot that just wouldn't go away.
Mm.
Went to the degree that like I went to a podiatrist, had an x-ray done, and there was nothing that needed to be done with it structurally. And so 2 years I had this pain. I did NET on it, and there were two different times that I did NET, and then the pain was cleared. But the one time it came back to something during my pregnancy with my twins. And the person that was doing it looked at me and said, were your babies breech? And I was like, yeah, all my babies have been breech. And he said, this point, the point on my foot that was hurting, is the acupuncture point for turning a breech baby. And he looked at me and he said, your babies knew that you weren't ready for them to enter this world.
Mm.
And after that, after I cleared that emotionally, I have not had pain in my foot since then.
Wow, that's
Yeah.
amazing.
Hmm.
That calls to mind the book. I'm sure you've read it. The Body Keeps the Score, right?
Yeah.
And were you able to figure out, why that, chicken or the egg? Was it the foot, or was it an emotion in you that was leading to that foot pain that was stuck that you had to clear out, I'm guessing?
Yeah. I mean, it was definitely emotional for me in that
Hmm.
case. Like I said, we tested to see if there was anything that needed to be done structurally, but what actually made the pain resolve was me clearing the emotions related to that.
Hmm.
And I mean, it made a lot of sense, right? Like I was
Hmm.
pregnant with twins. We had not even 2-year-old already, and no, I wasn't ready for them.
Yeah. Yeah.
And it's, I didn't know about NET then, but I truly believe now, had I known about NET, I could have done NET on them being breech
Mhm.
and those emotions around not feeling ready. And I think that also could have impacted their positioning in the womb and their ability to turn.
Yeah. So I'm bought in. I know, like, the emotional connection between the
Mhm.
body and the musculoskeletal system and beyond. But for those listening, this might sound pretty abstract
Yeah.
and pretty far-fetched. Can you kind of bring us back down to earth and just kind of explain why an emotional issue can manifest itself physically?
Yeah, so it's very common for emotions to manifest physically or to contribute to physical symptoms. So that stress gets stored in our body, and it could be something that doesn't seem significant. So a lot of times these original events that come up aren't necessarily these significant traumas that someone has had. It's the culmination of that stress over time that then starts to present itself in other ways. So, especially for anyone who doesn't talk a lot about their emotions or may suppress things, that is going to express itself in some way. And if you're not expressing it or releasing it in any way, it's going to express as those physical symptoms.
Okay. Okay. And then by addressing the emotions, you can therefore release that physical
Yep.
issue
Yeah.
entanglement. Yeah. Um, I don't know if you know about I'm sure you do, but I remember somebody told me some research about NET and how they were doing, I think they used fMRI studies to look
Yeah.
at blood flow to the cortex and to the limbic system. They actually
Yes.
found, I think it cancer patients had to retell their story of how they were diagnosed, and then they did
Hmm.
the fMRI, and all the blood goes to the limbic system away from the neocortex, and then they did NET sessions. I don't know how many it was,
They did 3 to 5 sessions of NET,
three
and
to
then they
five sessions.
redid that. And the brain scans, you can find them. I have them linked in all my
Hmm.
social media and stuff so that people can find it. But also if you go to netmindbody.com, they have the research linked there. But yeah, it's pretty amazing some of the studies that they've done with they've done some on heart rate variability, but the fMRIs are always the ones that are most talked about. It shows the parahippocampus, and not only is it lit up, but it's extremely red in those first brain scans. And then just 3 to 5 sessions of NET on that cancer-related incident, and then they show the brain scans afterwards, and there's nothing that is lit up on those brain scans. It's
Right.
pretty amazing.
Right. And so me as somebody who, I'm doing neuro rehab, things like that. If I've got somebody who's got a psychological hang up or emotional trauma and blood, doesn't want to leave that limbic system, or it's not getting to where it needs to go appropriately, it's it's a good thing that we have people like you who are doing NET so that we can kind of clear that. I like to call them emotional trigger points, free that up so that my therapies can then be more effective. So I think it's a really good
Yeah.
synergy that we
Yeah.
can have.
And I think that's a great example too. And a lot of time, and this is how, the founder of this technique is a chiropractor, and how
Hmm.
he found this technique. A lot of times when adjustments aren't sticking or other interventions are not working the way that we would hope they would, that technically, I mean, a lot of times that does lead to, oh, there's some sort of emotion that might be contributing to that. So especially someone who has had a hard time figuring out what's going on with them, or is feeling like the therapies that they're using just aren't as effective as maybe they traditionally would be for someone, I would definitely look at those emotional components.
Awesome. So how many sessions do you think it takes for somebody to kind of get rid of a negative emotion or a hang up emotion?
So this is really varied based on the person and their situation. Even when
Hmm.
people talk about like estimated length of time and like treatment with me, it's so dependent on what that person wants to work on and how deep those issues go, how many layers there are to it.
Hmm.
The studies that they have done have mostly been on 3 to 5 sessions, but again, that's for one very specific thing. And so when you think about a larger, there's a lot of different core concepts, core beliefs, and different things that contribute to the way that we show up in our day-to-day life. And so it can take more sessions than that to be able to make progress. And I always tell people, I mean, I do NET. I don't think there will ever be a time where I'm not also a recipient of NET because I think there's always things that we can work on and improve. And what I
Hmm.
really like about it is you don't even always have to know what those things are because the body just kind of leads the way to what needs to be released and where it's ready to go. But even things like I've done NET on being okay making money. And yeah, I mean, cognitively, I'm okay with making money, but there was some sort of subconscious block to being able to do that. So there's always things that we can address and work on with NET.
Yeah. And so I know traditionally from what I've experienced, there's muscle testing involved.
Hmm.
So I know we've talked a little bit about muscle testing on this show before, but it's kind of a two-part question. Number one, is that the way that you go about, testing the subconscious, I guess, or the emotions? And two, I know that you see patients remotely. How are you able to test those emotions remotely then?
So whenever I explain muscle testing, especially from a therapy perspective, I feel like what usually makes the most sense to people is explaining it as a form of biofeedback. There's been a larger increase of people just interested in therapy that uses biofeedback. And so when we're using the muscle test, that's what we're using it as. So it's a way of testing bodily indicators of change in physiology. Or change in the function in response to different stimuli. So, if someone was in person, they would be holding their arm extended typically, and I'd be applying pressure to that. It's not an arm wrestling match. It's not a strength test. It is literally testing the nervous system. And so when we do that virtually, we're testing more of the frequency. So I'm connecting with that person's frequency and being able to test the nervous system that way. So and whenever that gets questioned too, it's the same as how you're able to hear my voice right now from miles away and how you're able to see me on a screen or be able to FaceTime with someone and their picture show up. Though everything is frequency. So
Hmm. That's so cool. Yeah, I
yeah.
know there's yeah, I think more and more of that is becoming more and more, I think, generally accepted and understood, and so that's really cool.
Yeah.
Um, so how might, I guess, who would be your ideal client? Who's gonna respond the best? Who should seek care through NET and through you?
Honestly, anyone who is in a spot where they're ready, willing, and able to make
Mhm.
changes and wanting to make changes, as long as they're in that space where they're open and willing to do the work, regardless of what they're struggling with, there's ways of approaching it with NET.
That's a good distinction. Um, so if somebody is not in a place where they're willing to get better, is NET
Mhm.
then ineffective?
I mean, we could start out with some different PDs of I'm okay getting better, I'm okay being in therapy, I'm willing to be in therapy.
Mhm.
If they're at least willing to do those steps, then yeah, we could
Okay.
definitely help them clear some of those blocks to being able to get help and receive the benefits of NET.
Hmm. Okay. Do you tend to recommend that, people do both NET and maybe traditional psychotherapy or other types of therapy, or is it kind of all encompassing?
I think it depends. It also depends on the NET practitioner. So I am a licensed therapist and use NET with all of my clients. And There's some clients who prefer to verbally process more while we're doing NET. There's other clients who don't. Depending on what they struggle with, they may be seeing someone else for talk therapy and me only for NET. Um, but I find that typically it's pretty comprehensive and there's a lot of things that I'm able to address. So rarely do I have someone who sees another talk therapist in addition to me. But that being said, there are times where maybe their chiropractor is the person who's providing the NET and they're seeing a talk therapist in addition to that to help them process some of the things that are coming up with their chiropractor. So it really just depends on your practitioner's comfort level and what it is that you're struggling with. Because even though I'm a therapist, there may be things that still aren't really in my scope or things that I don't specialize in when it comes to certain diagnoses. So it just depends on the person and the practitioner for sure.
Gotcha. Okay. Um, if somebody wanted to reach out to you and find out more about you, how would they best do that?
So I can be found at Bowers Counseling and Wellness on Instagram. I have my link tree there. I also have a website, bowerscounselingandwellness.com. And my phone number is there. People can text me, call me with questions. I also do free connection calls if someone is wondering how I might maybe approach specifically what they're struggling with or if they have any questions about it.
Okay, awesome. Well, I really appreciate you coming on today and sharing your knowledge with our listeners and providing this great service to Ohio and to everyone who's using your services. So thank you again. And any final words of maybe encouragement or hope for those listening that might be, struggling with PTSD or anxiety or whatever it may be?
Yeah, I do want to say back to kind of the different, this just reminded me when you brought up
Mhm.
PTSD, the differences between traditional talk therapy and even some of the other forms of therapy for PTSD and trauma and NET. Sometimes I'll hear people say they're nervous to do NET because they're not sure what's going to come up.
Mm,
There's a couple different things to that I try to give as reassurance. One of them is your body's not going to go anywhere that it's not ready to release.
mm,
So I've even had people say, I know I've had this trauma, it hasn't come up yet. Why is
mhm.
that? If your body's not ready to release it, it's not going to go there yet. So rarely do I get people that end up being super dysregulated or struggle to get re-regulated when something comes up from NET because of that, because we're truly trusting the body to guide us to where it's ready to go and what it's ready to release. And the other thing is when we test back to that original event, and at any point when I'm testing things, you don't always have to verbalize what's going on. So let's say it came back to age 5 and I say, where were you? What were you doing? If that's not something you feel comfortable verbalizing, you can just get a mental image of that and I can
Yeah.
muscle test that. So just to kind of like take away some of those fears that people might have in, initiating, like making that phone call, deciding to schedule. That's another reason that I really like this technique. And if you're skeptical, like ask questions. I'm an open book. I'm
Mhm.
happy to share more stories and testimonies. And there's also a resource that I have linked that I can send you to that has some demonstrations of NET being done, like a live demonstration, which is nice if people are having a hard time listening to this and like actually being able to picture what's going on.
Yeah.
So that's a good resource too.
Yeah, that would be great to have, and I can link that in the show notes.
Hmm.
And then you also, I think that is something that I really appreciate about NET is, if you don't want to talk about it, you don't have to.
Yeah.
And I bet a lot of guys, probably might resonate a little better with NET where they don't necessarily have to talk about things.
Hmm.
Like I'm a very quiet person. I know I don't necessarily uh love to talk about my feelings. So if I could do something in a way that I can address things without having to, talk about it, sign me up.
Yeah. Yep.
I don't know if you've noticed that men tend to gravitate towards NET
I think
and
it'd be helpful for men for a number of reasons. I think that's one
yeah.
of them. And also just with people that struggle to identify emotions, because again, we're using the muscle test to be able to find those emotions. So it's not asking, the stereotypical, well, how does it make you feel, right? Like,
Mhm.
we're not asking the person that. We're muscle testing to figure out what that emotion is. And then I'm there to help people connect those things together and get to that core concept.
Gotcha. And I'm also thinking of some other things that people may maybe confuse with or just equate with NET, but things like EMDR or there's other things, maybe like
Hmm.
body entry type techniques. EFT, I think, is another one.
Yeah.
Uh, you know, why might somebody benefit more from NET over, say, something like EMDR or one of those other things?
So I'm obviously biased because NET is what I'm trained in my primary modality, but I have a lot of fellow practitioners who are trained in NET and EMDR,
Hmm.
and they also prefer NET over EMDR. It's still seen as more effective and more efficient. Just to give you an idea, I had a client who came to me after doing 6 months of therapy with a EMDR therapist, hadn't even really gotten into a lot of EMDR yet because there was so much difficulty with getting regulated and staying in her body and being able to be present. And so we started doing NET and saw way quicker changes in terms of her nervous system and her ability to be present and stay in her body. So I think because again we're still addressing all three of those, the physical, emotional, the cognitive, all at once. There's very few therapies that will do that and do it from the beginning of therapy. Like this is not a, oh, we have to prepare and have to cope and have a good foundation before we can start NET. We're jumping right into NET to be able to help with whatever it is they're struggling with. So I really prefer it because of that. EFT is similar because it uses the principles from Chinese medicine. It uses those pulse points and the tapping, but not necessarily the muscle testing piece to be able to kind of figure out those core concepts and the original events. And one of the reasons I like NET also, because personally, I don't have a lot of memories of my younger years. So let's say something came up at age 5. I probably am not going to remember what it's related to. And again, we can use the muscle test to help us create the picture to then be able to clear that from the body.
Yeah. Yeah. No, I appreciate that about it as well.
Yeah.
Well, cool. Yeah, well, like I said, this has been really informative and I've enjoyed talking to you about it, and I think our listeners are going to really appreciate um, learning more about NET as something that could potentially help them. So I
Hmm.
appreciate it.
Yeah.
So,
Thanks so much. Thank you for having me on.
of course.